Hello, everybody. Welcome, everyone, to this month's edition of Community Talks. On behalf of VLIR-UOS, I'm very happy to introduce today's speakers. We are very happy to introduce postdoctoral lecturer Christian Weume from Stellenbosch University, Professor Ilse Ruijsen from Ghent University, and postdoctoral researcher Charlotte Scheres, also from Ghent University. Their today's presentation will be about Climighealth, more specifically about the collaboration between Ghent University and Stellenbosch University, which tried to create new evidence for African policymakers on how to develop climate-resilient primary healthcare and to embed principles of planetary health into the training of family physicians and primary care providers in the African region. But of course, they're the experts on the topic. I will very shortly give the floor to them. Before we get started, I would just want to say that if you have any answers during the presentation, feel free to put them in the chat. And after the presentation, we will answer all of your questions using the chat. So don't hesitate to fill in your questions. Make sure to keep your mics and maybe also cameras off, because we are with quite a lot of people in the meeting room. And if your cameras are off, this will improve our internet connection. So yes, thank you. And also something good to know is that this meeting is being recorded. So if you want to watch it again, you can find it on our YouTube channel and also our website. So yeah, that is everything I wanted to say before we get started. Once again, thank you so much for speakers for being here today. And yeah, the floor is yours.
Thank you for the introduction. I'm Ilse Ruijsen, and I will be speaking from my experience as director of the Climighealth network. Just a quick introduction, perhaps, to why this team and why we want to present to you this particular project. We all know that climate change is happening, and it has been described as the most important public health challenge of the 21st century. We can see the impact of climate change on primary healthcare, and there's all sorts of adaptation needed to make healthcare systems more climate resilient. But we see this has been receiving particularly little attention throughout the globe and also in the African region. However, for the primary care provider, climate change will manifest in changes in conditions such as heat stroke, malnutrition, asthma, malaria, trauma, depression, post-traumatic stress disorder, and so on. And so this VLIR-UOS team collaboration between Ghent University and Stellenbosch University is meant to create new evidence for African policymakers on how to develop climate resilient primary healthcare and to embed principles of planetary health, as was already mentioned, into the training of family physicians and primary care providers in the African region. So, but before we get to the details of that project, I want to say a few words about this particular network called Climighealth, which has been the start of this whole collaboration. So the network is called, in short, Climighealth, which stands for International Thematic Network on Climate Change, Migration and Health, led by Ghent University. You can see the link to the website there. And the Ghent University main hub is being coordinated by me and Dr. Charlotte Scheres, who is also going to be explaining us a little more about the project itself in a few minutes. So an ITN, what does that stand for? It's an international thematic network, which means we, driven by Ghent University, want to want to bring together both staff members at the university, but primarily collaborate with international partners concerning a specific topic. And this not only in terms of research, but also in terms of education and outreach to the broader audience in our case. So perhaps many of you aren't really familiar with what could be this potential linkages between those three themes that the Nexus is actually concerning and that the network is focusing on. Usually I can spend an hour talking about all the interlinkages. I will try to keep it to 1 minute. In the Nexus and in the network, we depart from the fact that there is climate change taking place. And then you see arrows going down from climate change towards, on the one hand, migration, towards health and towards healthcare. And then you see also arrows going in both directions between those three elements. And so we know climate change is affecting mobility, human mobility. So that can mean more people migrating because droughts continue to fail, because they see their income shrink. And then that migration might put an additional strain on healthcare systems, but also the migration that follows climatic shocks or more slow climatic hazards might put an additional vulnerability layer to people's health. And then that, of course, then also interacts with healthcare provisions, the need for healthcare, and so on. So there's a whole system of connections within this nexus. And this also means that if you were to look for solutions to, for instance, make healthcare systems more resilient to climate change, it is also wise to take along the pathway through migration, which is also going to be manifesting more extensively in the future. And so that's why we are advocating for a more holistic approach where many elements, and then of course, these are not the only ones, there's also factors related to conflict that play a role in here, socioeconomic factors, and so on, that in a more extensive view on the nexus, we try to take on board. So what is the vision really of this climate health network? It is to render societal impact by, on the one hand, generating knowledge on these interactions between climate change, migration, and healthcare. And the ultimate goal of this exercise is to provide the elements to better adapt to mitigate and prepare for current and future effects of climate change, to have a greater understanding of the role of migration and its impact, and to develop ultimately more resilient, more inclusive and responsive health systems. And to meet that vision, the mission is to guide more comprehensive and sustainable responses to address these complex migration and healthcare patterns, which arise from and also contribute to climate change, although I didn't show that in the previous picture. So the network is really meant to to foster collaboration among scholars on the one hand, across different countries and across different disciplines. So we have in the team health scientists, climate scientists, economists, sociologists, and many more. And so we bring together all this expertise, also really trying to foster the inclusion of expertise from the Global South, which is too often underrepresented in this sort of research. But then we want to go beyond an impact purely in terms of research, and also have more development of educational packages around this nexus, and bring back the knowledge that is gained through this collaboration to the broader audience, and also fostering not only collaboration among scholars, but also with other stakeholders, non-profit organizations, and so on. I'm just gonna check the time. We did a whole exercise to define what are the priorities for research in this nexus, for which you can see a very abstract representation here. But so the main idea is that rather than encouraging everyone to conduct now research on this nexus as a whole, we can bring together people's different perspectives on elements within this nexus. So you have climate scientists who might primarily be coming in from the climate perspective. Me, I'm a migration economist. I would rather bring to this network my expertise on climate-induced migration or the connections between migration and health, and then bringing those three aspects together, also the health perspective, we can also learn about the connections in the network. And then there are two more streams that we invest in, namely the governance one, which is more overarching, and also methodology, because if you want to foster research in this field, requiring a holistic approach, you also need to look for more innovative, interdisciplinary, transdisciplinary approaches that allow to go beyond causal relationships. And so we here are also, here's an overview of our guiding principles. So you can see them laid out there. It's a matter of enabling not only researchers, but also NGOs, practitioners, journalists, to learn more about these connections in the nexus. We want to communicate those findings, break down silos by fostering interdisciplinary, intersectoral research and education. Also building up early career researchers through all sorts of programs we have in place. We just finalized the summer school on the nexus last week. And then also finally advocate for a climate resilient future. And I'm going to leave this, but you can see a few of the elements we have been investing in so far in the three big pillars of our attention related to research. There's some specific projects that have been coming out already. In terms of education, we have a very interesting module that has been integrated as in the Wonka course on environment, planetary health for primary care. And also in terms of public awareness, we are present at the COPs. Also in the next one, we have an interesting art exhibition showcasing the interactions between migration and healthcare in the Western Cape. And this is also a rotating one. So we will have it up also somewhere in Ghent in the near future. And I will leave it here. This is a screenshot of our website. I would encourage everyone to have take a look and see, find out more about the network. But I will pass on the word now to my colleague, Charlotte. Thank you.
Thank you, Ilse. I will move on for a quick introduction on the Teams project, where Christian will elaborate further in the final part of our presentation. So we got a 5-year funded project started in 2022 on fostering the development of planetary health research and education in Africa towards more climate resilient primary health care. And so this is a collaboration between Stellenbosch and Ghent University and Stellenbosch's Master of Philosophy in Family Medicine program. So there's active involvement with from the students, from the master students in this project. We also have collaborators from Ghent University, specifically the WHO Collaborating Center on Family Medicine that is based at our university. And promoters are Professor Bob Maj and Professor Ilse Reusen. I co-promote the project, and Dr. Christian Lokotora is also executing researcher on the Stellenbosch site. And next slide, please. Very quick, a few words on the motivation. So quite some of our research also with Climighealth and together with Stellenbosch starts from the point that primary healthcare is an essential part to achieving universal health coverage and towards the SDGs. We do know, however, that in many African settings and countries, primary healthcare is still not performing the way we would hope so, and that simultaneously we see the impact of climate change on primary care being underexplored, especially in research. And at the same time, climate change is one of the most pressing public health challenges. So that's the starting point, and that's why we, with the Teams project, we hope to contribute to more research on the role of primary care, and also integrate this with the discipline of planetary health, which looks both at the impact of climate change on health and health services, but also at how health services contribute to mitigate emissions and be more sustainable. So a quick overview on the research program. There will be 2 applied studies together with the Western Cape Climate Change Forum and their local Department of Health to eventually develop a tool to measure more preparedness and resilience, and also expand the health information system with climate change related indicators to better track and trace how climate change impacts health, and also to develop early warning indicators. A lot of this work will be based on 2 scoping reviews, which are already ongoing and have been published on the connection between primary healthcare and climate change on the one hand, and also on migration within Africa. And another part of the research program is centered around 5 case studies in different African contexts, where primary healthcare resilience will be explored in the context of climate change hazards that happen in these regions. The idea with this work is to really create a more active discourse by publishing original research, talking in conferences, publishing short reports and opinion pieces in several journals. Next slide, please. And a bit more about the case studies. Here you can see where they will be based. So we'll focus on the flash floods in Durban, on the cyclone Idai and displacement of the people in that area in Beira in Mozambique, on the severe droughts that have been experienced in the Kilifi district in Kenya, and on sea level rise, heavy rains, and also extreme droughts in Nigeria. This will be a mixed method approach based studies using surveys of local healthcare workers, but also collected health information for quantitative data, together with in-depth interviews with healthcare workers and impacted citizens to explore the impact from different angles. Quite important to say is that all this work is in collaboration with Prima Famage, which is the primary care and family medicine network for sub-Saharan Africa, which is coordinated by Professor Bob Maj at Stellenbosch, but is also has been launched together with Professor Jan de Mazenier and the team at Ghent University. We're also supporting Prima Famage with Climighealth, and so they bring the expertise from family medicine throughout sub-Saharan Africa on many of the studies here in this project. Next slide, please. And then a few words on the education program. The idea is also to implement planetary health education at Stellenbosch in the curricula and to attribute to what we call environmental stewardship of the student and the lectures. supporting under and postgraduate programs, continuing professional development, collaborate with interest groups on education for sustainable healthcare, and share the educational initiatives with the institutions that are part of the Prima Famet network and other institutions in different countries, with the eventual aim to incorporate these learning materials into different under and postgraduate education programs in different institutions throughout Africa. I think this is it for my presentation, and we can go now to Christian to talk a bit more about the progress of the team's project so far. Thank you.
Okay. Thanks, Charlotte. Thanks, Els. So I'll try to tell about some of the activities that we are doing here in Stellenbosch. As Charlotte said, that we are executing the goals of the project. So I'll talk about the research. I'll cover some activities in the research, education, capacity building, the networking, partnership, and outreach and system. So these are different themes that we are trying to drive our research here in Stellenbosch. Next slide, please. Yeah, so Charles said that we have 2 scoping reviews that we have started already. Yes, one has been already published. That was on primary healthcare and climate change in Africa. So out of that publication, we came up with 10 research questions, which are like the knowledge gap that we are trying then to start developing different research around. So the second scoping review is on migration and primary healthcare in Africa. We have done already the data extraction, so we are now writing the paper. The actual manuscript is ongoing. So at the same time, we have also started to evaluate. We have already the ethical approval for the evaluation of resilience of primary healthcare and primary healthcare facilities and services. But because we want to extend the collaboration with climate action accelerators, so we have made some arrangements, some amendments to the text. So we have resubmitted that again to the ethics. So we are at that level. But according to what I had already, so the amendment was not that much. So surely the ethical approval will get it very soon. So at the same time, we also we have started another research with the Prima Famet on some learning objectives. So we want to develop the question, what do primary care providers and managers need to know about building climate resilience? So with this one, through the Prima Famet workshop that we had in August, we tried to have some collaborators that will start the research with. So the proposal is already written. So soon I'll send it to the Prima Famet network, and then we'll start the actual research. Next slide, please. Yeah, so at the same time, we have some short reports that we have written on Cyclone Idai in Beira in Kalifi County. So we published all of them. They are, if you can go to the journal Primary Healthcare and Family Medicine Journal, you'll find those short reports. So from those short reports, we try now to have to collect them, to put them together and start developing like a review article that we want to write from those short reports. So that one is also ongoing, because we start like developing, collecting, reading through and find some similar themes that we can develop and start then write the paper. So we are almost at the early age of writing that. So we have also some MPhil students who are, 2 MPhil students who are running different research for their masters. So this on impact on climate change and child in northern Kenya. This by Dr. Beatrice, which is she's based in Kenya. And we have also another one on the experience of migrant with the sister Tuli, she's a nurse and she's based in Gauteng. Gauteng is one of the provinces here in South Africa where you find Johannesburg and Pretoria. So yeah, so both of them have submitted their proposal to the ethics, and we're waiting for the ethical approval. Next slides, please. Yeah, that was for the research. So this is what we are doing. So, but in terms of education, so we have implemented planetary health. We try to embed planetary health education into the MDCHB curriculum, so the undergrad medical student curriculum. So up until now, we have developed 4 modules, being and becoming, form and function, health and wellness, and dysfunction. So it's this out of 6 modules that we'll develop, because the remainder medical detective and intervention. So these modules, the 4 modules, we have already we start already teaching them. So the last one was just in August last month. That was dysfunction. So we're trying to embed planetary health. What means planetary health for the medical student when we talk about dysfunction? What we should understand I mean, what planetary health can bring as new knowledge to doctors who are in training to understand how we can save. We have to protect the planet. And then we protect ourselves. What are the implications in terms of health? So there are different ways. If you want to know deeper about our learning objectives in the modules, so we can also share it with you. But for the sake of time, I just want to move a bit quick, and through questions maybe I can respond to I can go a bit in details. So we have also I mean, trying to teach, not trying, we're teaching also planetary health in other, I mean, department to other departments. It's not only for medical students, but we're also trying to teach it for to the nurses. So developing, I mean, trying to enlarge our impact and collaboration to different departments like physiotherapy. We have, so we had already different modules, different classes with physiotherapy, and we also have it with in November, for example. I will have another class with I mean, not just sharing with psychiatry. So we're moving from one department to another, trying to enlarge the collaboration and then make a different program to know about planetary health, and then what we can do to embed it in their programs. So it's still a bit slow, but it's coming. We can see the interest really increasing. Different departments now are requiring that we come to collaborate with them. At the same time, for family medicine, we have already started embedding planetary health into the program of family physicians in trainings. So for the first year, what is planetary health ethics and human rights? What is planetary health in community primary health care? What is planetary health in leadership and governance? So we have developed it already. Different modules for the full programs of family physician in training, and we have started teaching them this year. Then we'll continue next year. So that's in collaboration with I mean, the Division of Family Medicine, with the postgraduate and undergraduate programs. Next slides, please. Yeah, so again, for education, so as I said, we're supporting other postgraduate programs. So we're collaborating now with Global Health, because we think this is one of the really important piece into running planetary health. So we are now collaborating with Professor Rene and Dr. Stacy Blaus. So we're trying to find ways we can, I mean, strengthen our research and develop different activities on the ground and here in the faculty. So that has already started. So at the same time, we also collaborate with, through trying to design and develop some professional development, continuing professional development, the CPD on primary health care with the health professionals. So mostly true family physicians, so family medicine, here in Stellenbosch, the program of family medicine in Stellenbosch and the University of Cape Town, and we'll try to find different collaborations with other universities. So for that, I wrote a paper that was just published yesterday on how we can run, how we can build a climate resilient primary health care. So throughout a primary climate resilient primary health care. So you can find it in Primary Health Care and Family Medicine Journal. So this is, we have written also a multiple choice questions that will serve for the CPD, so for continuous professional development on climate resilient primary health care. So you can also find it through, I think, no, they didn't publish it yet, but health professionals can go through those questions as a way of, getting their CPD. They will get their CPD point, of course. So yeah, at the same time, we are collaborating with the Sub-Saharan institution via Prima Pharmed. Charlotte told you what is Prima Pharmed about, and we're supporting different institutions and programs. So we collaborated with, we started collaborating with when we went to Malawi for the Prima Pharmed with Mangochi, I think it's the university. So we're trying to collaborate. We'll find a way how we can, send them our what we are developing here in terms of education materials. Next slide, please. Yeah, so that was about the activities that we are doing for. I was checking my time. The activities that we are doing for research and education, but at the same time, there was a need to develop also the researchers, try to bring them more knowledge about how to come with this transdisciplinary research, which are almost required, which is really required for the climate MIG health network. So that was the need of capacity building. So I'm benefiting for that, and we are also we have 2 students which are doctors. So as we need to lead them in research, there was a need of supervision. So at the same time, I'm going through different trainings for methodology with the University of Stellenbosch University African Doctoral Academy. So this year I've registered, but the program I was fully occupied. I have to go start to prepare for different things at the same time. As you can see, many things have been run almost at the same time, and then we have to find a way to make everything going well. So I've postponed my registration for the ADA, SU African Doctoral Academy. This is more of developing, I wanted to get more insight in methodology, but also I also need a course on epidemiology, biostatistics, genomics, machine learning, and artificial intelligence. Yeah, there is a need of that in the way that for us to, I found that we are bringing public health and primary health care resilience together. So there is a need to compute the potential and the potential impact of the global ecological disruptions on health, and in that way, we can help. The system, the healthcare system, to have directions of what actions or what activities, what programs, that how they should run it in terms of the impact of climate change for the excess of number of mortality or morbidity that it can bring. And then you'll feel it in the hospital, in the healthcare services. So once you know what is coming, the projections, of course, or through the evidence that we can bring, there will be ways of dealing with them. This is how we can be prepared for climate events in the future of climate event. That's how we can be climate resilient. Yeah, so I'm co-supervising, and those students, yes, next slide, please. These are all training that I was going through, the pre-dat for the teaching in health sciences. You should know what to do. So at the same time, we are trying to capacitate also some members through Prima Pharma network. So the research that we are doing, the scoping review, the 2 scoping reviews, we have involved different members from the Prima Pharma who are co-authors of all the papers that we are running, all the research that we are doing. But in terms of engaging with the network, design, development, implementation, education initiatives, I mean, as I said, we started with Mangochi University, but it didn't go through because we want first to have materials well written, and that when we're ready, we then send it we'll share it with other through the Prima Pharma network with other universities, of course. Next slide, please. Yeah, so because I'm talking about networking and partnership already, so we are really collaborating. We are active members of the School for Climate Study here in Stellenbosch, led by Dr. Guy Mitchell. So we are collaborating with them. We collaborate in writing Horizon proposal, and we are also collaborate with other people from with the global health. Yes, so we tried to write another Horizon grant that we submitted on non-communicable disease and heat. Both of them, unfortunately, they didn't go through. So, but we are trying to see how we can resubmit. I think if there are some questions about it, we'll try to respond in details after the proposal were not accepted, what we think to do. Yeah, so in that way, we are collaborating with the South African family physicians. So we developed the short courses. I wrote the articles. I told about it. It was published already. And we are also with the Prima Pharma, and for the Prima Pharma into our network, we had a workshop in 2022. In this year, we had another workshop, and I'm busy writing the report. Next slide, please. Yeah, again, the networking and partnership. Yes, so yeah, so we collaborate also with Climate Action Accelerator, which is based, I think, in Heidelberg in Germany, with Dr. Trish. I have to collaborate, Dr. Trish, Patricia, and Kieran. So we are also engaged with, we should be engaged with Prima Pharma, the international strategic partners. For example, Besserer Center, the Royal College of General Practitioners, but up until now, we don't have yet, I mean, real activities that we are, or research collaboration we are doing with them. So it's still in the pipeline. I think we'll get it. Next slide, please. So in terms of the outreach and policy, so we also don't have nothing yet that we are doing for the moment, but we aim to contribute to the development of policy and strategic development within the Western Cape. Surely after the research that we are running, we are having with them, so because we have I mean, quite a good research that will start soon with climate resilient primary healthcare, and developing the tool on how to evaluate the climate resilient of health facilities. After that, surely we will have will contribute to the policy and strategic document of the province. Yeah, so for in terms of we collaborating with SAHI, which is South African Association of Health Educations. So we collaborating with them. I've been in different webinars with them where I presented. We are collaborating also with the Wonka Africa and Wonka Global. I participated with the global Wonka Global. In the Wonka Environmental Group, where I presented, and then in the Wonka 2023, the international conference in Sydney, I will also go to present on the scoping review that were published already, primary healthcare and climate change. So yes, so that was for our participation. So in terms of system, so yes, to move, want to move towards the establishment of a center for planetary health. For the moment, we have already launched the Africa Hub for climate change, migration, and health. We are moving to a center for planetary health. We have already submitted the document here in the faculty. So once we have the permission and the necessary mean, we will start with the Center for Planetary Health. But at the same time, I would like also to announce that on 11th of October, we have our first Planetary Health Day research. So in that day, we would like to bring bring together anyone researching on any themes under planetary health and try to bring an inter and transdisciplinary approach of research on planetary health in the faculty. So this is what we are doing here on the ground. I think next slide. Yeah, thank you.
All right. Well, thank you so much to our three speakers for presenting your research. It was really, really interesting. I propose that we now go into the Q&A part of this community talks edition. There have been a few in the chat. If this is a call for all of the other people here in the Zoom meeting with us. If you have any other questions, feel free to ask them in the chat. A first question that I see is Christine Lentz, who asks, is there a participation or collaboration that includes bioscience or ambiental engineering and or nutritionists? I don't know who of you is the most equipped to answer this question, but I will.
What's the question again? Sorry.
The question was, is there a participation or collaboration that includes bioscience or ambiental engineering and or nutritionists?
If I have to, I can start. I don't know if they have, Prof. Ilse, do you want me to to start?
Yeah, I think you can answer specifically for the teams, and then I can also add something related to the network.
Okay, thanks so much.
Go ahead.
Yes, with us here in Stellenbosch, we don't have yet something in collaboration with Department of Biostatistics, but through with nutrition department as well. But with the Planetary Health Day, that will be where we will bring all these departments searching on anything on the planetary health, because planetary health is also the impact of climate change on nutritional deficiency. So there are some research that some are running through Global Health Department. So then we'll collaborate with them. Biostatistics will also be involved in that collaboration with Dr. Juliet Nyasiru. But we also want to extend that collaboration with anyone who can help, anyone who can come. So together we'll save the planet and save ourselves.
Go ahead.
There's also the collaboration with the School for Climate Studies. I think that is important to mention. And actually, I realized after I forgot to mention also something really important, namely that through that collaboration, actually, we have been able also to set up an Africa hub for the Climate Health Network, which Christian is leading. And we're in negotiations to do the same in Asia and Latin America, by the way. But I think that collaboration with the School for Climate Studies is quite important in general. which also goes beyond this particular team's project. And also at the start of the application for the funding of the network, there were some bioscientists involved, but it is true that the scope of the nexus as such is so broad, and that also has to do a bit with the way the arrows were pointing in the scheme I showed initially, where we start basically from climate change as a given, and then see we have been focusing more on what are the implications of that, whereas it has in the beginning been really meant to have also the arrows in the other directions covered more, which is why we think it is important, if you would have an interest, or you would know of somebody interested, that they reach out to us, because we really want, also for the team, but also more broadly, to have also more of the hard scientists on board of the network. I don't know, Charlotte, if you wanted to add anything to that.
No, I was going to mention the School of Climate Studies being involved in I think also in the work that we do with Stellenbosch University, and in general, the involvement of the school, which has a really interdisciplinary and transdisciplinary approach, just like the Climighealth network, for our future projects. So.
Maybe I can add to that, because there was a similar question related to the presence of sociology as a field in this whole collaboration. Charlotte already answered that both her and Christian are actually sociologists, and also more broadly, of course, they are represented and also very welcome to join in on the conversations and explore collaborations if there would be an interest.
All right, great. I see another question or another addition by Ashraf Kaji, who says mental health is highly relevant to climate change and also needs to be placed on the agenda. He also continued to answer that, as well as extreme weather events and trauma, food insecurity and depression, anxiety, suicide, distress, eco-anxiety, chronic worry. These are all things that need to be taken into account, of course. I don't know if there's something you want to add about this, about these themes, in what way you incorporate these topics in the research?
Yeah, I can start to responding. Yeah, Professor Ashraf actually is here in Stellenbosch, and thanks so much, Professor, for reminding us on how important is this collaboration with you. Yeah, actually, as we started already moving from one department to another, we also launched the Planetary Health Day. I don't know if you have received the email already, because we send it to different HODs. So I think when on the 11th of October, Professor Ashraf will be there. So we can really think on different researches that we can start running together. Very important themes to be involved in this network. I agree.
Okay, great. There's another question by Mia van den Bergen, who asks, what's the relation between planetary health and the concept of One Health from the World Health Organization?
Yeah, I can start to responding. So yeah, you see, planetary health is a bit more let me I mean, I'll take my point in two ways, in terms of the structure and in terms of the content. So in terms of the structure, planetary health is broader than One Health. So One Health is more focused on the interrelations, interactions, interdependency between the health of humans, animals, and vegetation. I mean, yes, vegetation. So vegetation, globally speaking, broadly speaking, I want to say. So yes, that interaction that we can't live our life without animals because of, I mean, our well-being depend also on animals, depend on the vegetation, but at the same time, One Health wanted to insist most. You'll complete me with other knowledges, but it's also one of the point, or the main point of One Health approach is zoonotic diseases. So the transmission of infectious disease from animals to human beings, and that can also be vice versa. So it's quite important that when you want to bring a human, you want to give good health and well-being to human, you have to start by also considering good health and well-being of animals and find ways that their interactions that doesn't bring cross infections from one species to another. So that's one of the point of One Health. But then planetary health is considering that aspect, this aspect as one of the perspectives to be considered, but taking it a bit broadly, that yes, but you also need the space. You also need the oceans. You also need, the space I want to talk about, the atmosphere, sorry. You also need the atmosphere, you also need the ocean, you also need all of them together in the planet Earth. The planet Earth is should be considered as through interdependency. So, but by looking through different global ecological drivers of ill health. So, if I can put it in that way, climate change, global warming, resource scarcity, land use and land covered disruptions. So with all together, you bring them together and consider the factor, some mediating factors, for example, the health system, people's wealth. So yes, human statement, the education of the people as some mediating factors that should come together. Impact on the manifestation, coming together with the manifestation of those global ecological drivers through, for example, the quality of air, the quality of water that we drink, through the education of a person, with those impact of the global ecological driver that can lead to a disease. If the person is not well educated, is more prone to be infected by infected water, which is not, it doesn't have a good quality. So, but if he's educated, so education as one of the mediating factors. So, in terms of that, the content, planetary health is again more broader. It's taking global health as one of the perspective, the perspective. But the two subjects are working together, very together, because they lead to the same object. I don't know if I've responded to that, but this is the point. Thanks.
Okay, thank you so much. I can see that during your explanation, Professor Jan de Mazemeer put up his hand. I think you want to add something, Professor?
Yes, I want to add something. Christian, you gave a wonderful description of what planetary health is. I think it's good that it's recorded because it really tells us about this global vision, this concept of looking at the interaction between the different dimensions and looking at it from different perspectives, from a multi-perspective approach. I think that's absolutely great. Mostly, I think that planetary health looks at this global concept as a way of looking at the planet and the health in a broader sense. One Health we often use when we are confronted with a problem to put in place a strategy. For instance, antimicrobiological resistance, then you need a One Health strategy because you have to address the problems of veterinary medicine. You have to address also economic aspects like salmon that that we use antibiotics to develop them economically. So that's more, I think, a strategic kind of approach that we use when we have to address certain problems. But of course, the two are linked together. The one as a concept and the other much more, I think, at the strategic level. But thanks for making it so clearly illustrated.
Yeah, I agree. It was a really good explanation, especially for someone like me who doesn't really know anything about the subject. So I really liked it. As it is already 11:57, I can see there are two more questions in the chat. I suggest we handle those two questions and then we close off. So the one question that still remains is there a relationship between climate change and the behavior of people? Which I think is a really interesting question.
Yes, maybe I can quickly come in there. Yeah, I think consumption patterns have been linked to increased emissions of CO2, which can then be linked to climate change and environmental degradation. So there's definitely a link to be made between behavior of people, but I think what is interesting there is whether we look at this on individual level or more on community, country level. Behavior of people also aligns with what our companies are doing in terms of emissions, what our countries are doing. So I think you can see this on different levels. And what is most importantly is how on a more larger scale, how are emission levels situated there. And I think if from a government standpoint, if changes are made there, then behavior of people will also follow into that direction. If you, for example, look at the many crises we've had in the past decades, but most recently COVID-19, where on a global scale, we were forced to adjust our behavior in a way. Look at, for example, limited transport options that were there through airplane, but also cars. There are already indications that emissions went down in that period. And then once things went back to normal, emissions went up again. And we see similar patterns that happened, for example, in 2008 with the economic crisis and oil crises before. So there's definitely a link to be made there. But quite importantly also for this presentation, it's mostly consumption patterns in Western country that have the biggest impact on global emissions, and almost to a very lesser extent in the African continent, who bear most of the consequences of global emissions. So that's an important remark to make. Christian or Ilse, anything to add?
Yes, I can say anything. So from the 5 foundational domains of planetary health, the Anthropocene and health, the movement, I think movement building and system change, yeah, the system thinking, the interconnection with nature, the equity and social justice. You see, just in terms of movement building and system change and equity, social justice, it's important that people change their mindsets on how they should live life here on the earth. We don't have another planet B. We have only this planet. So this is the message that you can find. You can see through different social movement of planetary health activists. So that needs we need the impact of an individual change, the system thinking. So we need to think a bit broadly and through that complexity of interdependency of our health and the health of the planet. And this is very important, as Charlotte talked about consumption burden. We need to change the way of using the natural resources. We can't think of human as the only being on the earth. No, human exceptionalism, as Professor Owi and Dr. Samuel Mayer in their books on planetary health, protecting nature to protect ourselves in 2020, I think, they spoke about this aspect of we need to change our behavior. So behavior is totally one of the pillars of planetary health.
Okay, great. I think that it's time for the last question of this community talks. And you already touched on what collaborations there are with other research disciplines. There's another question asking if there could also be a collaboration with agricultural universities, but particularly animal sciences. For example, I don't know if there's already a collaboration like that. Oh, okay, I see
Yeah.
nodding.
I think I can be brief, just saying yes, totally. I think that's the whole idea of having a holistic approach and moving beyond silos. And if we're thinking about human health, I think Christian has made the point very clear. This doesn't stand alone from animal health. So a broad approach, an encompassing approach is the way to go, and collaborations with these fields as well are absolutely valuable. Yes.
Yeah, great. Well, I think that's all the time we have for today. I would like to thank once again the speakers, Dr. Christian Mukutola, Professor Ilse Ruijsen, and Dr. Charlotte Scheres for being here. It was a very nice presentation. I think we can all agree that it was really well presented. Yeah, so thank you once again. I want to highlight that we have another edition of Community Talks coming up next month. Also an interesting topic. This will be about diabetes detection and monitoring in Bukavu in the DRC with the University of Ghent and the Université Catholique de Bukavu. So yeah, thank you once again, everyone, for being here. Thank you for your questions, and yeah, see you next time.
Thank you. Bye-bye.
Thank you for joining. Bye.
Bye.